How much does scoliosis treatment cost? Hey, Dr. Chris Scoobles, and today I want to talk to you about scoliosis treatment and what scoliosis treatment could potentially cost someone to go through. So the first thing is, scoliosis can be a major burden on people, both adults and adolescents. A lot of times in adolescence, it's more of a psychological or emotional viewpoint in how they view their body that creates stress and anxiety, possibly depression, or negative thoughts about one's appearance. And when we get to adulthood, it's a lot of times more a problem of dealing with pain and loss of enjoyment of life and how the painful scoliosis can actually impact their lives. But with all of those, there is an emotional, psychological, and physical, and potentially financial burden that it can actually play on someone. So when we look at scoliosis treatments, the cost can vary quite a bit, depending on what the scoliosis is, what treatments are required, where they live geographically, according to, in comparison to where treatment options are too. But let's take a look at some of these things. When we look at things like scoliosis therapy, this is going to be considerably the same as doing physical therapy. However, when you're doing this with a specialist, someone that's specifically trained in scoliosis treatment, that physical therapy will probably cost a little bit more going to someone that specializes in scoliosis physical therapy or scoliosis-specific exercises than someone just as general practitioner. But you also need to look at the outcome, because here's what we know. If general physical therapy, general chiropractic is not been shown effective in doing anything to impact the progression of scoliosis or potentially correcting it. So you can spend a lot of time and energy on just doing generalized treatments that do nothing to impact or actually help the scoliosis. Scoliosis-specific exercise by someone that's trained or certified to do those things like Schroth, things like CS, or even better, Scoli Balance, those have been shown effective at slowing the progression of scoliosis and in some cases even improving the scoliosis. So although the per session may cost more, you're getting a lot bigger benefit and also a better long-term outcome. When we look at things like bracing, I tell patients braces for your spine is very similar to like braces for your teeth. And there are some braces that are cheaper and some that are more expensive, and you kind of get what you pay for. For example, just doing a brace that's off the shelf, same design, manufactured for any body size, and then attempted to customize after the fact by adding some different pads and things, that's going to be cheaper than a brace that's truly custom made in a 3D formation for each and every patient. You get a brace as an adult, unless you have a fluctuation in weight of 30 to 50 pounds, you don't need a new brace. That one brace can last you your whole life, with maybe some parts being replaced here or there. When we look at someone if they have scoliosis that develops when they're younger, they're likely going to need more than one brace. So then it can be more expensive, or the treatment can cost more. But even like when we look at an infant, the other option is doing things like serial casting. And one of the problems with infants with some of the treatments is they use general anesthesia. And repeated general anesthesia can have a lot of negative impacts on brain and psychological development. So even though bracing may cost more in dollar signs, doing some of the other treatments may cost more and not as good as outcomes and negative consequences as well. When we think about surgeries, there's the actual cost of a scoliosis surgery. For example, doing a multi-level spinal fusion can cost $250,000 or more. But it's not the only cost associated with surgery. It's the treatment you're going to have to do beforehand. It's to stay in the hospital. It's follow-up treatments. It's treatments if you have a potential infection. Then there's all the other potential ancillary costs along with the surgery you have to consider. One last thing, there's the actual price, then there's the cost. The price is actually the dollar sign behind the treatment, but the cost is something completely different. And if you have a condition, let's say you have a child with scoliosis, what is the potential cost of that scoliosis if it's not addressed and not corrected properly? When the curve can get worse, it could end up causing surgery, it could have a lot of mental, emotional, and psychological impacts on someone. And then especially if someone's growing, give a small window of time to actually effectively treat it. If you don't treat it properly, it gets much harder to treat, and it can have much bigger implications or impact them more severely long term. The other thing, if you're an adult and you have a lot of pain, there's not a lot of treatments out there that can effectively treat scoliosis. Things like injections with like a steroid, or like a facet joint injections, or radiofrequency ablation. Those things are used a lot of times, or pain medication also prescribed a lot of times to try and reduce pain. But they can't do anything to impact the progression of scoliosis, and they may for short term provide some relief, but the curve continues to progress and get more and more severe over time. So my point with that, if you're an adult and you have painful scoliosis, you have to look at what it's actually costing you in your life. What's it costing you enjoyment in your life? What's it costing you in not being able to do activities you want to be able to do? And what's it going to cost you long term if you lose your independence and you're not able to live on your own or take care of yourself on your own because you have a progressive degenerative condition that negatively impacts your life? So whenever you're embarking on any kind of scoliosis treatment, you have to look at the immediate cost of the treatment, but you got to think long term. Because if you have the right treatment, in most cases, patients should get actually more sufficient at doing the treatment on their own and rely on providers less. Scoliosis-specific exercises, when taught properly to the right people, the treatments get less and less over time because patients can actually do those on their own. Bracing, a lot of times when we hit certain points, they don't need repetitive bracing, and so those get less expensive. Especially when you have an adult that has a brace, they don't need repetitive bracing, or if someone's done growing. But if you think about bracing, when we catch those earlier and people are going to be growing for longer periods of time, a lot of times they may need more than one brace, so you have to consider that too. But don't look at just the immediate treatment. Talk to the provider, like what's the long-term treatment, what's the long-term prognosis or potential costs. But understand doing the right treatment long term is always going to be the better economical option for you. So if you're finding this information useful, like, follow, or subscribe, and share with others you think would benefit from this information. And if you have scoliosis, or you have a child that has scoliosis, don't hesitate to reach out. Just give our office a call and ask for a free consultation to see if there's something we can do to help you.